Hello, everybody. This is part 2 of the HUD ICDBG NOFA training for fiscal year 2013. 2014, you can tell it's been a long day already. I'm not sure that we have the right slide up. It should be green. Yeah, part 2, there you go. Well, green sometimes. It is, okay. It's green, okay, I wanted green. I'm really grateful today that I have representatives from 3 other federal agencies, well, 1 other HUD colleague, to join me today to talk about this very important and interesting new funding opportunity to remediate and prevent mold in tribal housing. With me today, I have Lorene Burton from the Environmental Protection Agency. She will talk right after me. I have Warren Friedman from the Office of Healthy Homes and Lead Hazard Control. They just changed the name. And also Captain Kelly Taylor from the Indian Health Service. And some of their colleagues are also in the room with us today. This is really quite unprecedented. Usually when we do a webcast, it's ONAP people talking, but this has been a very joint effort in developing this first-time opportunity. Congress directed us to work with Healthy Homes Office, and we were very appreciative of the assistance from other federal agencies. So hopefully we'll learn a lot today, and we'll continue to learn as we go through this first-time opportunity. Today we're going to focus on right now, this part, we're going to focus on Category 2 funds for mold remediation and prevention. Those of you that participated in the earlier session learned a lot of details about how to apply through grants.gov and in general some of the requirements and rules and eligibility aspects of ICDBG. Today we're going to focus on definitions, rating factors, and scoring. For the mold grants, we're going to look at overviews of mold health effects and assessment and remediation and where to go to find help as you put together your applications for the first time. I do recommend that you, if you didn't tune in for the first part of this day, to view part 1 to learn about the things I just discussed. General section is what guides all of the HUD programs, the requirements there, thresholds there, general ICDBG requirements, and how to apply electronically. We will not focus on that in this session, but the slides will be available shortly, and this website and the previous one will be, webcast will be archived, so you'll be able to see it. Congress, in the HUD appropriation for fiscal year 2014, specifically said it wanted to fund $10 million for grants for mold remediation and prevention that shall be awarded through one national competition to Native American tribes with the greatest need. So we are going to be looking at trying to measure who has the greatest need, and that's who we'll be funding in this funding opportunity. One of the reasons Congress funded this set aside, I think, is because, well, there were some visits to Indian country, and they saw some of the mold firsthand, but also several years ago there was a study, and many of the viewers probably, the tribes participated in that study, and they were shown to be quite a high prevalence of mold in tribal housing. And not surprisingly, mold exposure is linked to respiratory symptoms and asthma, and so Congress said, okay, this is a bigger picture than housing, so we want you to also work with the HUD Office of Healthy Homes and Lead Hazard Control. So you'll see we are today. I want to let you know that the study that I'm referring to on the slide is posted on the HUD web page. It was kind of hard to find before, but now we have several publications posted in the ONAP's resources page. If you go to what's new, there's a link to it, and the the mold study is there, as are several other studies. In 2014, there's 2 categories of funding for ICDBG. Category 1 is any ICDBG eligible activity. Category 2 is for mold remediation and prevention. As I said in the earlier presentation, you can apply for and receive funds under both categories. You will be submitting the application in one you will be submitting requests for both categories in one application when you apply through grants.gov. So how much is there? $10 million. No funds set aside for HUD in there. It's $10 million for tribes to remediate and prevent mold. We are not allocating the funds per region like we do with the regular ICDBG grants to the 6 area ONAPs. It is a national competition. Applications will be rated by a national panel in headquarters, some of whom may be at this table, and they will not be rated in the field offices. So that is a difference with this pot of money. There is a pretty detailed definition of mold in the NOFA. 3-part definition. Mold is defined as visible growth of, is it fungi or fungi? Fungi. I was hoping somebody would correct me earlier. On surfaces of units, residential buildings, or their interior. Second part of the definition, mold remediation, for purposes of this NOFA, is defined as long-term solutions to a mold problem, including mold that has grown on surfaces and addressing the source of the moisture entering or being dispersed. We really want to focus on the long-term solutions. And then we have, of course, mold prevention, which includes action taken when mold is present in minute amounts to significantly reduce the likelihood of mold occurring or significantly growing. So that's our definition, 3-part definition of mold prevention, remediation and prevention in the NOFA. And then also we've defined tribally owned or operated housing for purposes of this NOFA. It means housing that is currently owned or operated by an Indian tribe or TDHE, tribally designated housing entity, or was previously assisted with HUD funding. So that means the mold remediation funds in Category 2 cannot be used on private housing, only on housing that was previously assisted by HUD or is currently being assisted with HUD funds. So that is a distinction there. So now I'm going to turn to Lorraine. She's going to give us a lot of details on where mold comes from, what to do with it, and why it's a problem. So take it away. Oh, and she needs a little remote. That would help. There you go.
This one, right?
Yeah, on the right.
Okay. Hello. My name is Lorraine Burton, and I'm with the Indoor Environments Division at the U.S. Environmental Protection Agency. Today, I'm going to discuss where does mold come from, why we care about mold, and what to do when you do have mold. And I'm going to leave with some resources that are available through the HUD site. Correct. Where does mold come from? Well, they're a natural part of our environment. Molds and other fungi can grow virtually anywhere. Mold spores are present indoors and out. Molds can grow in all climates. Sometimes people think because they're living in a dry climate that they may not have mold issues. However, they can also have mold issues, and it can be in all parts of the country. Why do we care? Big part is about the health effects. You can have allergic reactions, you can have asthma attacks, it can be toxic or irritating effects. In some people, you can also get opportunistic infections. Mold can also cause structural damage to the buildings, materials, and furnishings. Mold, also with the changing climate conditions that a lot of us are facing, you can have there also an increase of the frequency intensity of storms, especially water-related storms. And there's property damage, there's also flooding, there can be water intrusion, and all of that can lead to a potential increase in mold. So that's why we care. What to do? First thing to know is to grow, mold needs moisture, it needs nutrients, something to eat. And that can be anything. It can be wood, it can be paper, it can be foods, it can be insulation, and it needs oxygen. So just like every other living organism, you need basic things. Of those things, it would be difficult to get rid of all of the food for the moisture and to get rid of the oxygen and for us to live. So you would need, the basic thing that you can do is moisture control. We recommend that moisture control is the key to mold control. So you want to, and this is the biggest thing of everything that we're going to say here related to what you need to do, is to fix water problems, to control your humidity, fix your leaks, get rid of any standing water. You want to assess the conditions before you're doing cleanup and remediation. Your response will depend on several things, including the type of water that's damaging the materials, whether you're able to clean up and dry materials within 24 to 48 hours before you can get mold growth, and if the damage is from clean water. If it's from sewage or other things, you need to do some special remediation procedures. You also want to know, do people want to always go and test? Do you really need to know what kind of mold it is? In most cases, the answer is no. You don't really need to know what kind of mold it is. There are no federal standards or guidelines to check your test's compliance against. And if the mold is visible, then you know it needs to be removed. There are some cases where sampling is important. You may want to use sampling to check that you've gotten the cleanup. It's very complex to do sampling. It's also very expensive, and it's difficult to do well. If you must sample, a lot of times you need to make sure you've got a professional involved. And you need to know why you're sampling and what you want to do with the results. To remediate, you need to identify the steps to fix the water or the moisture. You need to determine your size of your problem. You need to select cleanup methods for the moldy items. You need to deal with that you have appropriate ways to protect the occupants in the area. You need to know whether you need to contain the mold and in a certain area and the cleanup area from other people. You need to know, based on what type of mold it is, or I should say how much mold it is or how big a problem it is, you need to know whether you're going to need personal protective equipment. You need to plan for how you're going to remove the materials from the building. You want to remove them in a way that keeps the exposure from going to other people that are in the building. And most importantly, you want to have a communication plan. You want to know how to talk to the occupants that are there, talk to others in the community, and let them know what's happening and how you're going to go about dealing with the issue. Some additional points to consider is whether you want to do this work in-house or whether you need a professional. If it's a bigger problem, you may need to get a professional. If it's a smaller problem and it's just a matter of cleaning up surfaces or repairing things, you may want to have personal protective equipment, and you may be able to do it yourself. Those are things you need to determine beforehand. You also need to determine whether you're going to use any kind of chemicals to the cleanup. Biocides can be used, and there's several of them. They must be used appropriately. You must use them with using all the directions. But it is important to understand that molds are allergenic and their spores are allergenic. So even a dead mold spore could cause problems. So you have to remove it, not just spray it and think it's all gone. Also, you need to deal with safety. Most importantly, dealing with safety. You don't want to touch moldy items with your bare hands. You want to avoid getting mold spores in your eyes. You don't want to inhale mold spores. So it's really important that you have the proper personal protective equipment. You also want to avoid creating any new indoor environmental quality problems, or IEQ problems. I've given you a reference there to our website, our Indoor Air Environments Division website. We talk a lot about all kinds of indoor air problems. So, for example, you don't want to be cleaning up the mold and create a problem that causes a ventilation problem, or you don't want to clean up and shut down a system that is going to cause a combustion problem. So you want to look on this site and on the Healthy Home site here at HUD and see what kind of things you want to avoid while you're doing this. So are you done? If all of your water problems and moisture problems are fixed, you've removed all visible mold damaged materials, you've gotten rid of the moldy odors that might be present. If you've sampled, you should find after cleanup that any concentrations and kinds of molds and mold spores should be similar to what you find outside. You should have no signs of moisture damage or mold growth on revisiting. Your health complaints and physical symptoms that you attributed to mold should be getting better. But all in all, at the end of everything, it's a judgment call. It's a matter of having that expertise, that professionality to know whether you've gotten it clean enough and you fixed your problems. Most importantly, you want to fix your problems. There's several types of documents available and resources available. You want to use technical specifications and guidances and protocols, but you have to use them with professional judgment. And not all of them are going to be exactly written to fit your situation. So when necessary, you need to adapt these guidelines and programs for your situation. The next few slides that I've had here are some basic mold and moisture resources for you. We have our Indoor Environments Division website, and we have a section that's on mold. Healthy Homes here at HUD has a wonderful section on mold and moisture as well. We have a guidance document that's called Mold Remediation in Schools and Commercial Buildings. And though it says schools and commercial buildings, again, it's guidance that can be adapted to your situation in other types of buildings. We also have a brief guide to mold and moisture in your home, which is a document that's well written. It's also something that you may want to hand out to those in your community to help them understand some of what's going on. We have a document called Moisture Control Guidance for Building Design, Construction, and Maintenance. That's a newer document. It is written in a manner that people who do design, there's a section that's directly addresses how they can do the work. Construction, there's a section for them. Maintenance, there's a section for them. And it also has several test and verification methods in the appendices to help you. There are some additional resources which aren't totally about mold, but you can pull out some information from them. We have our Indoor Air Plus program, which is a guide for home builders, but they have a specification set that has very specific guidance on how to build for mold resistance. We also have our Healthy Indoor Environments Protocol for Home Energy Upgrades, which is more about existing homes, and you can find, again, information in there very specific to mold, but to all the other issues that you want to make sure you don't create while you're fixing the mold problems. We also have a tools for schools and a design tools for new schools. So if your work is going to be done in the school's environment, these documents have mold and moisture sections that can also be helpful. And the last thing that I wanted to touch on is there are several research type documents that have pulled together a lot of the information that's out there on mold. There's a couple from the National Academy of Sciences. One that I recommend is the Damp Indoor Spaces Report. We also have a scientific findings resource data bank that is you can get to from our website, but it's off the LBNL website, and they have a section where scientists have gone together and looked through a lot of the dampness and mold and health information and pulled it together for you. We also have a training session on online mold course that's an introduction to mold and mold remediation for environmental and public health professionals. And we also have several mold-related webinars. You can check our website for information periodically, and there'll be announcements for those types of webinars. And hand it back to Roberta.
Okay. Well, thank you. Gosh, that is a lot of information. And I think that we now know everything there is to know. No, I learned some new things. I took a lot of notes myself too, and I've been researching a lot about mold so far to put the NOFA together. Thank you very much. I'm sure we'll be in touch about these things. I'm going to turn now to a little bit more about what some of the requirements are in the NOFA before I turn it over to Warren to talk about some of the factors, rating factors. Again, I will go through these relatively briefly because I think many of you were in the earlier session. If you weren't, the information will be in the slides that will be posted shortly. There is one ceiling nationwide for applications for mold remediation. It is $400,000. If everybody requested $400,000, we would fund 25 grants with this $10 million. I don't know if that's what will happen. I don't know if we'll get, I don't know if we'll get 25 applications. I hope we do. I hope we get a lot more because then we'll know that the need is out there. That is the ceiling nationwide. It's the same in Alaska as it is in Maine. So just so you know, that's not going to change it. Ceilings are one of the screening factors. So in other words, if you come in and you ask for more than that, you won't get funded under this funding opportunity. But as I mentioned earlier, you can apply for a Category 2 grant, which is the mold funds, and you can also apply for a Category 1 grant and use it for mold remediation. So you can still, in other words, if you want to do a really big bang-up job on some of your projects, some of your units, you could come in and ask for, it depends on how much. You'd get $1 million per se if you, I think, if you, let's say in Alaska, their cap is 600 for the other grants. Now, mind you, you may not get both grants. You might get rated successfully under the mold one, Category 2, but you might not get rated successfully based on the competition in your region for Category 1. But there's no harm in trying. And if you're successful, and you could get in Alaska up to $1 million to remediate mold. So that is something to note. As I said, that's what I just said. I was asked a question earlier this week about whether or not a TDHE could apply for one part and the tribe for another part. No, it's one application. So if a tribal organization is going to be the applicant, they could apply for both types of funding. If the tribe and it wanted to have the TDHE do the mold work, the TDHE would be the subrecipient. But it's one application through grants.gov for these funds. The eligible applicants are the same as they are for ICDBG over the years. Tribes, tribal organizations, you have to meet certain criteria spelled out in the NOFA for what a tribal organization is. We just said that. If you are applying for housing rehab under Category 1, as well as these mold remediation funds under Category 2, your housing rehab cost limit per unit is listed on the slide. In addition, if you were funded under both categories, this would still be your rehab cost limit. In other words, just because you got 2 grants doesn't mean you could spend in Northwest region $100,000 on the unit. It's still $50,000. It doesn't mean that that's all it will cost to rehab that unit or remediate the mold, but that is all you will be able to spend of ICDBG. So that's a little bit of a distinction and something to know if you apply for both. Again, earlier we talked about threshold requirements. There are threshold requirements in what's called the general section. For all HUD programs, there are program threshold requirements for ICDBG. You can't have any funds that you haven't paid back. We talked about that. There are also project-specific thresholds for ICDBG, and the one that will apply for the mold remediation funds is, not surprisingly, the housing rehabilitation threshold. So what that means is you have to have rehabilitation standards already adopted for the units that you are going to remediate the mold on. You also, if you're going to remediate the mold or prevent the mold, what have you, on a unit that's a tribal unit, tribally owned unit, you also have to make sure that the home buyer's payments are current. As I mentioned earlier, you cannot use these funds in Category 2 to assist purely private housing. So that's just that. You should review the general section. You should review the whole NOFA to see which ones you want to apply for. As I mentioned earlier, all applications this year have to be submitted electronically unless you request and receive a waiver of that requirement at least 7 days before the application is due. You would request the waiver of the area ONAP administrator, even if you're applying just for the Category 2 funds. We'll figure it out at HUD how to get that done. Okay, so you decided, oh boy, I want to go after this 400,000. I have units with mold. I know, I've seen them. What do I do? Well, you're going to have to submit all of the items that are listed in the general section in Section 4. A lot of them are exactly the same as you would be submitting for the regular, so-called regular ICDBG program. We discussed them in Part 1. But there are some unique ones that you are going to have to submit for the mold remediation grants. If you're submitting a request in the same application for both categories of funds, you must submit 2 narratives. And each narrative must contain information about the 5 rating factors. You also need to submit 2 one-page summaries, like the first page of the narrative of each one. I know that might seem like a lot, but it will really help us in our review so we can get these applications reviewed quickly and get the money out on the street to you as quickly as we can. You will be required to submit an implementation plan to show the HUD reviewers how fast you're going to be able to get this money spent and do what and when. If you're requesting funds for both categories, again, we're going to need 2 implementation plans. All these forms have numbers. They're listed in the NOFA. Same thing with the budget. You're going to submit an application for a community center under Category 1, and you want to submit an application for mold remediation under Category 2. What do you have to submit? 2 budgets. Okay? Please don't put them together. That will really slow up the review, and it might, could possibly bump you out. I don't know. We want to really see two budgets. We want to make it clear, in part because, or in big part because, the people in the area offices are going to be reviewing your community center building, and we in headquarters are going to be reviewing your mold remediation request. And we want to make sure we have everything we need on one piece of paper. There are 5 rating factors for the mold units, mold grants, just like there are with the others. They're listed on the screen. The points are slightly different for the mold remediation grants than they are for the regular grants in Category 1. We'll go through them very, very briefly. Warren will spend a little bit more time focusing on the Category 2 grants. There is a table in your NOFA, in the NOFA that was posted, that spells out Category 1, new applicant, current applicant. Category 2, new applicant, current applicant. It looks kind of complicated, but it's in there. You must receive a minimum of 70 points to be funded. This applies to both categories. Most, at least in the current, with the regular ICDBG program, it's way above that. Applicants are getting much better in writing applications. Cutoffs are way in the 80s, if not in the 90s. So be very careful to look at every aspect of the NOFA and submit everything that we ask for. Up to 33 points in capacity. If you are funded this year under both programs, Category 1, Category 2, or either or, your progress will be measured. If you were funded under the regular program in the past year, your progress will be measured for both categories this year. Even though you didn't have mold last year, we're still going to look at what you did. We want to make sure you have the capacity to spend the money that you're asking us for. The points are on the screen. We want to know that you either have or can obtain people that know how to do this type of project. Obviously, if you've never remediated mold before, you want to try to figure out how to get that or get some training so you can get that. But we want to know, we're going to look for the type of project you're proposing. So in other words, don't submit in your application, oh, we've done 3 ICDBG applications, but we've built sewer projects. It's not going to help you with mold too much. So make sure you put down that it's for the type of project you asked for. And who's going to administer it? And you want to also know who's your project director? What has he or she done? Has he or she had recent, relevant, and successful experience? Now, maybe you haven't exactly done mold remediation, but if you've done housing rehab that might have incorporated mold, put that in too. You want to try to get as specific as you can for the type of application you're requesting funds for. We're going to look at your implementation plan. The more specific it is, the better. Don't just say, I'm getting the funds, I'm going to hire a guy or a gal, and I'm going to remediate the mold. First 6 months, first 9, we want to see what, did you do bids? Did you do this? How we want to see as much specific as you can. We also want to have, again, 2 projects, 2 types of projects, 2 implementation plans. 2 categories, 2 plans. We want to know, again, this was discussed in Category 1, if we want to know, do you know how to manage the money that you get? This is the same as it's always been for ICDBG. If you've requested funds from ICDBG before, you know we ask about this. We're going to look at findings. If you have findings, we're going to factor these into the mold grants too. So just because it's a new mold opportunity, we still want to know that you don't have too many problems and are going to be able to do this grant also. Because Congress is looking very closely at these funds also. Same thing with your procurement policies and how you manage your contracts in the past. We want to look at that, how you're looking at how you propose to. Are you going to meet these criteria in the regulations that aren't there, but they're on the previous slide? Do you have any findings? Do you have any audit concerns about this? We're going to look at your past performance. Again, even if you didn't do mold remediation in the past, we are going to look at what you did. And we're going to also look at, you don't have to submit information in Subfactor 2 for past performance. We're going to look at what we have in the record. If you want to, you can, but we have all that in our files. The area office has that, and we will be asking them to submit that to us in headquarters so we know when we rate your applications, oh, they weren't too good with their past grants. So we'll find that out because we're going to do some points with this. And again, it's all spelled out in the NOFA. The better you did in the past, the more points you're going to get. We're going to look at, did you close out the grants in the past in a timely manner? Did you have any, again, findings in the past, audits in the past? Did you submit them? Are there problems? So we're going to look at those. That's pretty much the same as it's been for ICDBG in general. There's, again, if you look at the table in the NOFA, there are some nuances with the scoring. We kind of had to do it that way to make things add up to 100. But, just try to address everything that's in the NOFA. One of the big things that Congress was concerned about in this funding opportunity is they wanted to really make sure that the money goes to the entity, the tribes or tribal housing authorities, housing organizations that need it the most. So we spent a lot of time discussing with those at the table and others around the country and the area ONEPs, how do we measure need for remediating mold. You know it when you see it, but who's got the most? What's the worst? So we worked very closely, as Congress directed, with the Office of Healthy Homes and with Warren, and now I'm going to turn to Warren, and he's going to talk about what we ended up in the NOFA this year and see how it goes. Here you go, Warren.
Okay, thank you.
Thank you.
And I want to start off actually by asking Roberta a question. You talked about the caps for the housing rehab costs. And the question that I have is whether these are average costs for the grant or individual costs, whether each home has that cap as its limit. Wonder if you could clarify that.
So Warren, you asked whether or not if they got a grant and it's 20 units, do they get 20 units times 35,000, or can they spend no more than 35,000 on each individual unit?
Yes, so that if one unit
home costs
needs,
more?
again, just using these
Yeah.
numbers, 40,000, but another unit needs 30, it averages to 35. So would that be allowable, or is it that there's this cap at 35,000?
Historically, we have had the cap at the individual per unit level. I don't know, I do not think we have thought about that right yet about this particular funding opportunity. I don't want to give a definitive answer now for sure to say never again would you ever be able to combine it or go higher. I think we're going to probably stick with the way we've done it, but I'd be willing to discuss it when I leave here today.
Okay, thank you. That's a good point for resolving something
Yes.
that some of our viewers may be asking themselves as well. So I now want to go to the rating factor 2 elements, then I will go to the rating factor 3 and its elements. So the first subfactor is on need and viability. And for this, the applicants have to provide evidence of mold. As Roberta said, we at HUD are interested that these funds go to the places where there is the greatest need. And so having very specific, concrete information that supports the assertion that there is a big mold problem will help in your getting more points. In addition, the assertion can't just be by anybody walking off the street and saying, I know how to see if there's mold there. The person who does this, or if it's a large enough area, the people who do this have to be qualified to make this assessment. So what we are looking at is that for the assessment of how much mold there is and how big the problem is, you can provide photographs, you can provide information on what the residents feel, their experiences, their reactions. Similarly, you can provide evidence of any diseases that they have encountered as a result of the mold, in particular respiratory diseases resulting from typically inhalation of mold spores. In addition, if you have evidence from the 2003 HUD study that Roberta referred to, you can provide that evidence, and also, because that was over a decade ago, provide information on the condition of the units at this point. Now, the scoring on evidence of mold is based on the percentage of housing units in the tribe's inventory that have mold. And as you see on the slides, we have threshold at 30% and threshold at 50%. If there is evidence of mold determined by the qualified person in at least 50% of the inventory, the full 8 points for this subfactor are provided. If it's less than 30% of the inventory and there's no third-party evidence, I should say, or there's no third-party evidence, it's just an assertion, then there are no points. And in the middle, it's halfway and 4 points are provided. Now, in subfactor C, there's a similar issue about what the formula data are for these costs. And so we have these factors, and the points range from $4,000 plus, getting no points, all the way down to $327 gets the full 9 points. Now, in rating factor 3, this is the soundness of approach. And as you've heard from Roberta and Lorene, it's very important for us to know exactly what you want to do and how you want to do it, and whether it addresses the needs of the project and it's going to be done in an effective way with adequate quality control over the process. Now, within this, we have subfactors for you to describe the project and tell why you're doing it in the way that you're proposing to do it. We look at your budget, your cost estimates. Similarly, we look at for this NOFA, 2 of the HUD policy priorities, and I'll describe what those are. And for that, you can put that you are interested in neither of them, one of them, or both of them, and depending on the quality of your answer, you will get no points, or 1 point, or 2 points. But for most people who are applying, they see this as a good way to link up what their grant is going to do with what HUD considers important. So we've laid that out and said if you are going in this direction for each of these 2 items, you can get points. As Roberta indicated initially, it's important that we not only take care of mold that exists today, but also make sure that there won't be mold coming back in the future, or if mold does come back, that it will be addressed promptly. So what we do in looking at this, in your soundness of approach, you have to tell about your plans for long-term strategies. And this is to remediate mold, not only now, but to make sure it's going away for good. Similarly, you have to identify what materials you're using for construction. If you're doing this as a joint Category 1, Category 2 project, you clearly have rehab that you're thinking about. That's the construction we're talking about. But even if you're just doing Category 2, you may find yourself looking at tearing out some spaces in order to get at mold that you need to remediate. And so it's important to identify the construction materials, show how they're relevant. Similarly, the techniques that you're using for either cleaning up, remediating, repairing, renovating, or other activities will be useful for resisting mold. Now, in the soundness of approach, you also, in addition to talking about the building, you have to talk about the people. And the people are the staff who are undertaking these activities and the residents who live in the homes who are affected by mold. And you have to train the staff as appropriate on assessing mold and other staff on remediating mold. And there are a variety of resources, and Lorene has pointed you toward many in her parts of the session this afternoon. Now, in addition, you have to reach out to residents. You have to keep them informed as to what's going on, as Lorene said, but you also have to educate them as part of that outreach as to how they can help prevent mold from reoccurring. So it's important to recognize that even the best project on a Monday is useless if on Tuesday building materials are flooded. And if that flooding occurs because of negligence by the residents, that is in part on them. So the mold problem could be something that they had induced, not intentionally, but because they weren't following good practices. Now, in most cases, people don't intentionally flood their place, but it's important that they be educated in what they can do to prevent mold from reoccurring. Now, talking about the budget and cost estimates, and 8 points is a considerable fraction of the total score, we want you to break down your costs by line item. So you have planning and administration costs clearly laid out. And in your soundness of approach, you have a narrative that says what kind of planning you're doing and how you're doing it. Your administrative costs, you should be describing what these are, and the NOFA and the general section and the regulations that underlie these activities indicate what activities are administrative, and you should break down your budget by these line items. These cost estimates should be clear for a reviewer to understand. And as always, it's not that the person who's reviewing this is somebody who is familiar with your housing or your specific area. It's somebody who's far away. In this case, somebody who may be in Washington, D.C. So you have to be so clear that somebody who has no understanding of your situation can assess in a way that you want the person to assess what you're basing your decisions on. Now, in this part, we also want you to describe the qualifications of the people who prepared the estimates. Again, as part of our concern with quality, we don't want estimates to be just made off the top of people's heads. We want folks to have a good understanding of why they're doing what they're doing when they propose these estimates. Now, subfactor 3 also includes, as I mentioned, these policy priorities. And the general section of the FY14 HUD NOFA lists a variety of priorities for the department. And different NOFAs select different policy priorities because of their relevance. For this NOFA, in this category on mold, we are looking at two of them: promoting economic development and economic resilience, and then increasing energy efficiency and the health and safety of homes. These are detailed in the NOFA. In the general section provides detailed information, and you'll see information in the specific category within the ICDBG NOFA itself. And you assess how you are linking your proposed project with these two policy priorities. As always, the clearer you state it, the more likely that somebody will be able to understand it. The more specific you are, again, the more likely the person reviewing it will say, yes, they know what they're doing, and they have a good understanding that they will actually accomplish it. So you're making a commitment when you apply to do these two things. Now, in the economic development, the specifics are you have to show how the project will create jobs. Now, because these jobs are associated with this project and the NOFA runs projects for only specific times, these are not necessarily permanent jobs for a career on this project, on this NOFA, but these may be permanent jobs. One of the things that we hope at HUD is that our grants will create permanent jobs. Now, whether they are permanent jobs or jobs for the duration of the NOFA, this is what we want to see. We also note that there are some jobs that are full-time jobs, some that are part-time jobs. The more clearly you describe your approach for job creation, the better for somebody to be able to assess whether it is working toward the policy priority. That's on one side. The counterpart is business opportunity. And these are local businesses in general, because they are the ones most closely tied to the location of the work. So here too, you should describe how your approach will create business opportunities. And again, short-term, long-term considerations are appropriate. Now, we like to see a flow of investments into small businesses and also into nonprofit organizations that either or both have a focus on serving low-income families. So the goal here is have jobs, businesses, and activities that benefit low-income people. On the side for increasing energy efficiency, the policy priority has a choice of approaches. There is a green building standard approach and a renewable energy standard approach. These are related because the green building approach has different issues associated with keeping the home healthy. And the renewable energy standard is focused on the sources of energy that are used by the building. Now, at this point, we look at sustaining the activity. And as you see, the 12 points here, also a significant fraction of the total number of points for the NOFA. And the intent here is that you demonstrate that you're going to help a community stay viable, not only during the course of the grant period, but also afterward, that you're going to help the community and keep the homes healthy, keep the people healthy, and keep businesses in a beneficial situation, and keep the labor market in a beneficial situation on an ongoing, sustainable basis. What are you going to do to keep this going even after the grant period is over? The criteria for these issues vary by the type of project and by the approach that you're using. So you should look at the NOFA rating factor 3, subfactor 4 for more details. Now, within this, we talk about some of the specific factors of looking at maintenance responsibilities. In terms of sustaining the work, it's not just fix something that is visible today and walk away. It's fix it that's visible today, but also engage the tribe and or the participants' capabilities in ongoing maintenance to help prevent this problem from recurring. And this involves saying who does what, who's responsible for what, whether it's taking action, reporting information, undertaking quality assurance. A wide range of things are needed for this, and here is your opportunity to explain it. And when you are involving entities, especially outside of your own organization, in other words, if you're partnering, you need written commitments that those activities will be undertaken. If it is an activity that the applicant is undertaking, then that commitment is given by the application overall, and the applicant's signature, the authorized organizational representative's signature to undertake these activities. But when they're partners, we need to see a written commitment, not this is a nice idea, but this is what we, the partner, will do. And I mention that because there are letters of support that we often find in NOFAs around the department. I'm not talking about this specific grant program, but in general, we get letters saying, hey, it's a great idea, rah, rah. Well, that gets 0 points. We need specific written commitments for specific activities, specific dollars where appropriate, to specific resources that are being provided. That's what we can judge this on. Now, in rating factor 4, we start on a different topic about leveraging resources. I'm going to turn this back right now to Roberta to continue.
Okay. Warren, thank you very much. I wanted to, that was great. I wanted to just add to what Warren said about sustaining the project. You know, those of you that have received ICDBG grants in the past, that we do look at certain criteria. There's a number of items that you must do. You must have, how are you going to maintain the unit? How are you going to insure it? How are you going to maintain security? Those things we're also going to look at. So in addition to the things that Warren described, please look at the criteria in the NOFA, because those things are, just because it's category 2, we still are going to look for those in terms of how you're going to sustain this project too, because that's just how that goes. So we're almost done with the rating factors. Leveraging is an important one. It's up to 10 points. This is a little bit higher than for the category 1 applications. Actually, this comes right from the Deputy Assistant Secretary. Wanted to show that tribes that were receiving money for remediating mold were really going to step up and come up with some funds to get it done. So whereas the other grants, ICDBG grants for category 1, it was up to 8 points. This is up to 10 points if you can demonstrate that you are bringing 30% of the project's cost to the table. You'll see it was 25, used to be the biggest one on the bottom, and now it's 30. So everything else is pretty much the same. The eligible uses are correct, the same. The eligible uses, eligible leveraging, types of leveraging, what's ineligible for leveraging is the same. None of that has changed. It's just that we've increased the points for category 2 for leveraging. So that's a little bit different. Factor 5, talks a little bit about, what's disallowed, what you have to submit. You want to know it's on letterhead, who's submitting it, is it really going to come through, and what happens if you can't get the money. So that's all spelled out in the NOFA, so I urge you to look at that. Factor 5 is pretty much the same for both programs. We're giving 10 points for this factor. We want to look at what is this particular project doing to impact the community as a whole, and how other entities in the community are working together with you. This doesn't mean the entities that are giving you the money. This is like what other kind of entities, service providers are helping. It might not apply as much in mold for service providers, but I'm sure there's all sorts of linkages there. So I have to, excuse me. So there are 2 subfactors in this category. One is community connections and viability, and the second one is outputs and outcomes. We are looking, as I said in webcast earlier today, we are going to be looking at what are the outputs? How many units are you going to remediate? How many units are you permanently going to resolve the mold in? How many families are going to be helped? How many kids are going to be not sick? You know, we want to look at what is measurable about what you're proposing to do. That's your output. So we want to see in your narrative in rating factor 5, outputs. Then we also want to see what's called outcomes. These are a little bit more global and bigger picture. They are more like, well, sort of back to the sick children. There are so many fewer children are sick, or other ways of measuring things. We don't have as many, you know, I can't even think of one now, but emergency room visits, Warren suggests, correct. Other ways you can, what is the outcome, what is the result of this? Not how many units you fix, but what is the result of this input of federal dollars into your community? What has it done? So we want to see that in your narrative, and those are the kind of things that when you do your annual report, your called the ACER for short, we will want to see what you've done. And Congress, you can bet, is going to want to see what you've done, especially with these mold funds, because you may or may not know it's up for consideration again. And so we don't know if we'll get them for 2015, but maybe we will. Hopefully we will, because the need is certainly there. So that is rating factor 5. What I'm going to do now is turn it over to Captain Kelly Taylor, and she's going to talk a little bit about how Indian Health Service works out in your communities and what, if anything, they can do to help you as you go down the path for these proposals.
Thank you, Roberta. Okay. I'm Kelly Taylor. I am the Director of Environmental Health Services for Indian Health Service, and I'm going to just talk a little bit about some of the things that environmental health might be able to do to help you with this funding opportunity. Indian Health Service is the principal federal health care provider and a health advocate for 566 federally recognized tribes. We have 12 regional, or we call them area offices across the country, and we serve over 2 million American Indians and Alaska Natives. So tribes have an option to assume control of programs that Indian Health Service previously provided. So if they have contracted or compacted with Indian Health Service to take the environmental health program, that means the environmental health staff that they would be talking to would be tribal environmental health staff rather than the Indian Health Service staff. So whoever it is that you work with, I encourage you to get with the local staff to see what they can do for you. But today there's probably over 50% of the Indian Health Service appropriation that has been contracted or compacted by tribes. The Environmental Health Services mission, well, we're a critical part of the Indian Health Services preventive care program. A lot of people think of Indian Health Service as just the clinical health care providers, but they have a very robust preventive health care program out in the tribal communities, and that's what we're a part of. Our mission, the Environmental Health Services mission, is to eliminate environmentally related disease and injury in tribal communities in support of the Indian Health Service mission, which is to raise the health status of American Indians and Alaska Natives to the highest level. We have fewer than 300 environmental health staff across the country, and that includes federal as well as tribal. We have a formula that says how many people are needed to do the environmental health work that's out there, and it says we need over 700 people. So that means we have to be really good with setting priorities. And we do encourage environmental health staff, whether they're tribal or federal, to get with the tribal communities they work with and get their input so that we know what your priorities are. So if your priorities are to help with mold problems and mold prevention, then we'll do our best to do what we can to help you with that. Environmental health staff work in tribal communities to prevent disease and injury by monitoring health status and investigating hazards in the environment. We provide technical assistance and training, and we also support community-based projects that employ best or promising practices. Our staff provide technical assistance and public health services in a variety of environmental health issues, but most notably safe food and drinking water, children's environments like schools and daycares, vector-borne and communicable disease, and healthy homes. So what can environmental health staff do to assist you with this funding opportunity? Well, we've already started distributing information about it out to our contacts. We've put it on our listserv. We've had conference calls with area environmental health directors, and they have asked their staff locally to contact tribal housing authorities and other tribal programs that they work with and make sure they know about this opportunity. In some cases, environmental health staff, whether it's federal or tribal, they might be the qualified third party that could document the presence of mold, or we can point you to those people who are qualified to do that. But the environmental health staff that we work with would be, some of the qualifications would be that they have registered environmental health specialists, credentials, or registered sanitarians, healthy home specialists. They could be industrial hygienists, engineers, indoor air quality specialists. There could be mold specialists. There's also community health representatives and public health nurses out there that might be able to help out. But if the tribal staff or Indian Health Service staff is unable to document the presence of mold, maybe you can work with state or county health departments, colleges or universities, or even private organizations. We could also provide technical assistance and support with other portions of the application. A lot of times we're asked by the clinical staff to investigate incidents of asthma or other respiratory diseases, so we'll make a lot of home visits. We could also already be investigating mold problems with the tribe. So we could help with the report of findings, with photographs, We may even be able to help with those outputs and outcomes that Roberta was talking about. And I've heard that some of our staff were even offering to help review sections of the application before they were sent in. So I would encourage you to get with the local environmental health staff. We have a website for those contacts, the federal contacts. It's on the slide. But whoever it is you're working with, tribal or federal, do get with them to see what they can do to help you out, and I'm sure it'll be mutually beneficial. That's it, Roberta.
Great. Well, thank you so much. Well, that's great. They're all going to be coming to you now. Well, I wanted to just, we're almost done today. Okay. I'm going to talk about what, again, I've talked about this earlier today, but so you've worked with Indian Health Service, you've read a lot of the reports from EPA, you've looked at some of the guidance on Warren's website. You've put your application together, you sent it in electronically, and you've not waited to the last minute. Then it's going to come into HUD. We are going to screen it to make sure you're an eligible applicant, that you didn't ask for more than the cap of the money. The project is eligible, well, it probably will be eligible, that it meets all the required components, that at least 70% of the funds will be used to benefit low and moderate income people. That'll pretty much happen that way through the housing component discussed. We're going to review it for thresholds. We discussed the housing rehab threshold that you have to meet. You have to have that code. You have to make sure residents are up to date with their payments. We'll look at all that. If you passed all that, then we'll rate you according to those 5 rating factors. You have to receive at least 70 points to get funded. I'm sure that, well, I don't know. With the Category 1 applications, people score way above 70. So I don't know what will happen with the mold applications because it's the first time. We're all learning as we go. We at this table are learning. You all will be learning. We in headquarters will be learning. We'll review them. We'll rank them. We will, if there's technical deficiencies, some little thing is missing from the application, we'll ask you to send that in within 14 days. If you get that letter, make sure you get it back in 14 days or we'll give the money to the next person. I urge you to look at the part 1 for more details on that. Make sure that you respond to the things. What I would like to do, though, is tell you that all of the participants at the table have given you a lot of websites. I think if you have any questions about this particular funding opportunity, you should contact me first. My information is in the NOFA. My email address is roberta.l.humans@hud.gov. And if there's any facilitating I can do here to get you any information, I will do that. I think I mentioned earlier that we on the HUD webpage, on the ONAP webpage, in Code Talk under ONAP resources, we have a new What's New section where we talk about this new NOFA opportunity. We have a link to the NOFA there. We also have a link to, I think, about 15, maybe 12 to 15 resources, some of which the participants at the table have mentioned. Lorene gave a lot of good information. There's a lot of information out there. It's like how to consolidate it and put it together. If you are funded, or you or your tribe is funded under this opportunity, you will be required to participate in a webcast similar to this one, but with a little bit more detail on ways to remediate mold. Can't tell you when that will be, but we will make that a requirement. We want to make sure that everybody's on the right page, doing things the right way. Whereas it's not required that you participate in the HUD NOFA training or watch this webinar. We will require you to do that. You also will be required to participate in any type of evaluation that Congress mandates or HUD requires. It's in the NOFA. It's spelled out in there. And there's protocols for not taking personal information from people, et cetera, privacy rules and things like that. But like with most HUD grants, you would be required to do that. But in particular with this, because I think Congress really wants to know is are we really getting rid of the mold, or are we going to have to come back and fund it again in a couple of years? So I wanted to let you know that also. Again, if you have any questions, I've kind of talked through these slides. If there are any questions about how to submit your application electronically, as I said in the earlier webcast, your first place to go is the HUD, not the HUD, the grants.gov help desk. It's open 24 hours a day. As I said in the previous session, please do not wait until a couple of days before the deadline, because I can't tell you how many calls I get from people saying they forgot to register, or they don't have somebody's name and they didn't have this. You don't want to go through all this work and all this training and all this research and documentation to not be able to submit your application at the last minute because you forgot to do something. I can't emphasize that enough. It's really so unfortunate when that happens. So I would urge you to do that. There's a lot of information on the grants.gov website about how to submit applications that way. If you can't do it that way, you can submit a waiver request up to a week before the deadline date, but you have to have good cause to be able to get a waiver. Unless anybody else has anything to add, that's the end of my official slides. I know that there will be individual trainings at the area ONAPs. I don't know how much they will be discussing the mold component of the NOFA, but they might. They're all going to be held in the next few weeks. I urge you to, I have the list somewhere, but I probably can't find it right now in my information, but it will be on the slides, or at least in the archived webcast from the earlier session. The dates will be mentioned there, but you can always call your area office about that. So I would like to thank all the federal partners for coming over on what is now, I think, I haven't been outside in a while, a very hot and humid day. I know we'll be working together with them as we proceed this year and perhaps in years to come. And feel free to send me any questions that you have about this funding opportunity, or ask your area ONAP office, and if they can't answer it, you know that they will call me. So thank you very much, everybody, for coming today, and I'll be glad to get a glass of water right now. Okay, thanks a lot. And to the crew behind the scenes. Okay.